Good afternoon. Myself Preeti Chaudhary, physiotherapist, Department of Physiotherapy, National Institute for Locomotor Disabilities, Kolkata. I would be moderator for today's session. It gives me immense pleasure to extend to you a very warm welcome for the celebration of World Multiple Sclerosis Day. On the behalf of Department of Physiotherapy, NILD Kolkata. The today's webinar is on multiple sclerosis, the Indian scenario and multimodal physiotherapeutic approach. I would request all the participants to keep their video and mic off to avoid any interruptions during the session. I welcome our today's guest and speakers, Dr. Gunjan Kumar, Assistant Professor, Department of Neurology, PMCH Patna, and Darshpreet Kaur Ma'am, Chief Physiotherapist, Bihar Neuro Center, Patna. Also welcoming Director, NILD Kolkata, Dr. P.P. Mohanty Sir. He is not able to join due to some meeting. Welcoming DDA and HOD, PO Department, Dr. P.K. Lenka Sir. Assistant Director Training, Ami Iqbal Sir. HOD Physiotherapy Department, Shri Praveen Kumar Sir. HOD OT Department, SER Department, Nursing Department and other in charges, Nodal Officers of the CRCs and Rehabilitation Centers of NILD, my seniors, colleagues, students and all the participants. Now with the permission of our guest and dignitaries, we would like to start the program with lamp lighting. Okay, so let's proceed to the next session. The consecutive session would be on multimodal. Yes, sir.
डॉक्टर गुंजन, थैंक यू सो मच. एक क्वेरी है.
Yes, sir.
कि बीइंग अ रिहैब प्रोफेशनल, जब पेशेंट, जैसे आपने बताया कि जब पेशेंट आते हैं, बहुत सारे पेशेंट अंडर डायग्नोज्ड रहते हैं, पता ही नहीं चलता है कि इनको मल्टीपल स्क्लेरोसिस है. सो जब हमारे पास भी बहुत सारे पेशेंट ऐसे आते हैं तो जे वो इनिशियली कंप्लेन की हमारे हाथों में टिंगलिंग सेंसेशन है, समटाइम्स दे हैव अ वीकनेस, समटाइम्स दे एसोसिएटेड विद सम विजुअल डेफिसिट्स आल्सो. सो उस तरह के कंडीशन में इनिशियली फर्स्ट एपिसोड जिसको हुआ है पता नहीं रहता है कि मल्टीपल स्क्लेरोसिस. उस तरह के कंडीशन में एक रिहैब प्रोफेशनल के लिए कुछ सजेशन, सो दैट वी कैन मेक अ बेटर डायग्नोसिस फ्रॉम रिहैबिलिटेशन प्रोफेशनल पॉइंट ऑफ व्यू.
So one thing is there, पहला चीज है कि what I truly believe is that, and what we have been also trying to instill in our therapists is that rehab professionals should have a basic knowledge of MRI. That is one thing. So you need to read MRI, at least get an idea whether the MRI is normal or abnormal. That is one thing is there. Second thing is that don't ignore the patient or don't shoo the patient. Patient कुछ भी बोलता है, just give him some time. There might be some atypical symptoms. जैसे आपके पास patient आते हैं with weakness, but if the patient, like what happens is that the patient spends more time with you than with us. So the patient may be more comfortable confiding in you. तो अगर पेशेंट कुछ बोलते हैं कि जैसे हमें ब्लैडर के भी सिम्टम्स हो रहे हैं, या बोलते हैं कि कभी कभी हमें लगता है, या गर्म पानी से नहाते समय हमें लगता है कि आंख में अंधेरा हो जाता है, या कभी कभी लगता है कि आंखों के आगे रोशनी नहीं आता है, तो इफ द पेशेंट कम्स टू यू विथ वीकनेस बट हैज दीज सिम्टम्स ऑल्सो, please get a detailed neurological evaluation done. And before taking up the patient, just do a small neurological evaluation. कहीं भी अगर आपको थोड़ा सा atypical symptom मिलता है, जैसे patient weakness आया, वो अगर वीकनेस जनरलाइज वीकनेस है लेकिन अपगोइंग प्लांटर मिल रहा है या कुछ भी एबनॉर्मल मिल रहा है या गेट आपको थोड़ा सा स्पेस्टिक लग रहा है, टोन ज़्यादा लग रहा है, सो दीज आर सम ऑफ द माइनर इंडिकेशंस कि गेट ए डिटेल न्यूरोलॉजिकल इवैल्यूएशन डन. सो दिस वुड बी जस्ट माय टिप सर.
थैंक यू सर. वन मोर क्वेरी सर, वन मोर क्वेश्चन.
यस.
कुछ पेशेंट हैं जब आते हैं, हमने एक नॉर्मल वीकनेस के साथ आए, स्ट्रेंथिंग एक्सरसाइज दिया और पेशेंट चले गए. जब सेकेंड एपिसोड में आते हैं तो दे हैव अ सीवियर सिम्टम्स एंड उस समय कुछ क्वेश्चन करते हैं कि सर हमारी मतलब ये क्या ठीक हो सकता है, नहीं हो सकता है, लाइफ के हमारे मतलब मॉर्बिडिटी मोर्टेलिटी के रिगार्डिंग. सो उस पर कुछ आप लाइट डाल सके तो.
सर एब्सोल्युटली ट्रू. इस होता क्या है कि had shown in my slides कि जैसे it starts with the relapsing remitting. Relapsing remitting में क्या होता है कि पेशेंट को एपिसोड्स आया, they almost recover 100% होता है. तो many of the patients they do not adhere to treatment या डॉक्टर शॉपिंग करते हैं या गूगल से they start कि हम लोग सिर्फ डाइटरी पे रहेंगे, पर्टिकुलर टाइप ऑफ डाइट या कुछ हम लोग क्या सप्लीमेंट्स लेंगे. So there are many false information इस तरह के हैं. So what happens is that when they get a second relapse, that उसके बाद हो सकता है कि वो आपका प्रोग्रेसिव कोर्स में चला जाए उसमें. And many of these patients they have underlying depression होता है, they are very anxious, they have cognitive impairment also. So it becomes difficult. So it's very difficult to assess. तो उसीलिए we have these rating scales. So EDSS is something which we all should be knowing about. EDSS simple सा है, it's there, components are there. We should be assessing the patient. But apart from that, the patient needs a multidisciplinary approach and हर symptom को आपको treat करना होगा. जैसे there are some which are easier like weakness over the time, they improve. What are difficult is ataxia is very difficult to treat. आपका cognitive impairment is quite difficult to treat apart from this, and spasticity can be very difficult to treat in these patients, and bladder and bowel. So we have to tell the patient कि आपके ये problem है, आपको इतना expectation जैसे रखना है उसमें. It may or may not improve, but you have to take your medications and you have to come for rehab every time. Rehab maybe adherence is very, very important in these patients.
Thank you, sir. Thank you so much for your valuable time. Thank you,
sir.
Any other questions? Okay, let's proceed for the next session then. The topic for the next session would be multimodal physiotherapeutic approach in multiple sclerosis warriors. The session would be taken by Darshpreet Kaur ma'am, Chief Physiotherapist, Bihar Neuro Center, Patna. Ma'am is a MPT in Neurology and Psychosomatic Disorders. She had publication in various index journals, presented in various national and international conferences. She has achieved many milestones like global finalist in multiple sclerosis brain health, developed 10-week motor imagery program for multiple sclerosis patients, first Indian physiotherapist to deliver satellite symposium for Japanese multiple sclerosis patients, BMJ case report reviewer since 2009, life member of MSSI, IAP and IFNR. A very warm welcome to you, ma'am. Let's start with the presentation.
Thank you so much. At the onset, I would like to thank Praveen sir and the entire organizing team for giving me this opportunity. And multiple sclerosis is something which is very, very close to my heart, and it's been over 15 years that I've been associated with this society. So let me start with my presentation. Are my slides visible?
Yes, ma'am, it is visible.
Okay. So as we, like Dr. Gunchan has already highlighted about multiple sclerosis, so I'm going to touch very little things about its pathophysiology and others, which are more relevant as a rehabilitation expert. So now we know that the myelin sheath that gets affected, and it is a disease of both gray matter and the white matter. And as we can see, the myelin sheath helps in faster conduction, and when it is being affected, there is a slower conduction of the signals. And overall, if we see, there are many symptoms, like there can be hearing difficulty, tinnitus. It is usually familial. There are certain studies. There can be nystagmus, diplopia, blurring of vision, dysarthria, dysphagia, and it occurs at very young age. I would say maybe the most productive age, and weakness may progress to paralysis. There are bladder bowel issues. There is constipation issues, walking difficulties, vertigos, etc. So when we talk about like what as a rehabilitation expert we can do in this case, I would say it's best to go through evidence-based practice, because evidence-based practice helps us to take wise decisions based on our clinical experience, the patient preference, that is really one of the important aspects, and the research evidence. So quickly, we'll touch through all the topics, how we have been actually doing this over past 15 years. So one of the most important thing is spasticity management. Spasticity is prevalent and it's one of the most common symptom in multiple sclerosis patient. So before we manage, its adequate evaluation is important. So that means we need to carefully assess the patient history to determine the functional impact of spasticity, the exacerbating factors, and the physical examination to see which all muscles are involved and how much are they efficacious. So a host of options are available for the management, and I'm sure most of you might be knowing these. That is therapeutic exercises, physical modalities, complementary or alternative medicines are also there, oral medications, chemodenervation, and implantation of intrathecal pumps. So choice of treatment, basically, it depends on the combination of extent of symptoms, the patient preference, and the availability of services. So whenever we talk about rehabilitation services, one of the very important factor that always has to be considered is the patient and the caregiver preference. So whatever tailor-made therapies we are giving, it should be as per the patient's capabilities. Okay, and there are certain characteristics, like when we undertake the evaluation of spasticity, it is very important to closely monitor the muscles which are involved. And frankly, if my patient is able to walk, the task becomes really easy, because one of the easiest tool that we do in our department is we make a video. Just make a regular video through your smartphone of a patient walking, like forward and then backward, and then slowly analyze each and every aspect of the swing and stance phase. That is going to give you maximum idea about what all gait abnormalities are there. So quickly, let's see that if there is hypertonicity in the plantar flexor, then definitely it will be toe tipping down. So we have a catching toe kind of gait, and there'll be a difficulty to make clearance in the swing phase, and the tendency of the patient to fall would be higher. If there is increased spasticity in the quadriceps muscle, then again, if you see the video in the slow motion, you will see that whenever there is a heel strike and the loading phase that happens, my patient is not able to straighten the knee, they are keeping the knee bent. And if there is a difficult spasticity in hip adductors, then we'll have the scissoring gait. Or if there is an increased tone in hamstring, then there is more tendency towards the buckling. So as per your analysis of the gait, you will get immense idea what kind of spasticity exists in my patient and whether I need to break that completely or not. Okay, so this is a simple checklist which I took from Multiple Sclerosis Association of America. So like whenever we have, like usually what happens when a patient comes, we just undertake few assessment charts, we make our tables, and that's it. It's very important to take the qualitative feedback from the patient also. Like, do you experience these symptoms? The wordings of the patient will help us to understand whether they are referring to some tightness, some spasm, cramps, ya chamakta hai. These words in the local language, in whatever way they can express, they become a very, very important tool to describe that what kind of spasticity they are actually suffering from. And then there are certain important questions. Do you suffer muscle discomfort? Please ask the area. And how often do you experience these symptoms? And what is the severity or how painful are these symptoms? I'm sure VAS scale is something we all have been using. And what areas of your life has been impacted? Because at the end, the rehabilitation focuses on improving quality of life. Because when we talk about neurological rehabilitation in neurological disorder, one aspect which has to be always considered is improving the overall quality of life, because most of the diseases, they do not take a reverse path, but definitely it can be slowed down to a great extent. So progression slowing is one thing, but quality of life maintenance is equally important aspect. And do any of these activities worsen your spasticity? Then we have to ask which all activities make the spasticity worse, and different kind of treatment what they have been taking, that also needs to be taken a note of. So next we talk about muscle strength and power with persons with multiple sclerosis. So before we proceed, let me tell you this entire presentation, ever since we've been part of multiple sclerosis, we make sure that we go through all the latest literature that has come. So I have picked up the information from the systematic reviews and meta-analysis, reviews of reviews, so that we are able to provide you a broader and clear picture how to go about it. Okay, so now this is very interesting. Most of the patients says, ma'am, our fatigue increases in multiple sclerosis. Exercise also induces fatigue. So do we need to do strength training and power training? So that is really one of the very interesting questions. Way back, maybe in 2010 and all, we started searching from the answers for this, and there were many literature which said that reduction in muscle mechanical function, that means the isometric strength, the dynamic strength, the explosive strength, that means the rapid force development and the muscle power, is affected in multiple sclerosis. Now, these are the prime parameters for any kind of muscle action. And then the study showed that reduced lower extremity muscle strength and power, reduction in these muscle mechanical power are definitely going to affect our walking ability, our balance, sit to stand, climbing, everything objectively and subjectively. So what is the main question here? Do we have the methods and techniques where we can analyze these muscle power function? Second, what happens to muscle mechanical function in persons with multiple sclerosis? All right, we know that it tends to reduce. And what is the effect of progressive resistance training? Because that is the usual modality we use by calculating 1 RM, and then we further keep progressing as our patient deems necessary. So these are the major roadblocks, whether we should give muscle strength and power training. Let's find out. Isokinetic dynamometer is the gold standard for quantitatively analyzing the muscle strength and power. But the question is, this setup itself is very expensive. Next, muscle strength, power, and rate of force development is definitely impaired, and this is more pronounced during maximal, moderate to fast dynamic muscle contractions of the lower extremities. So what you will see, most of the patient will say कि जब हमें धीरे-धीरे चलना है, we are doing fine. But whenever there is a panic situation, that means I have to cross the road, or if suddenly somebody comes, there's a doorbell, I have to go and open the door. That sudden actions make me more wobbly and I tend to fall. So please understand that the muscle strength and power, these impairments are more during maximal to moderate to fast dynamic contractions. So whenever such situation arises, this becomes more pronounced. And yes, progressive resistance training can improve muscle mechanical function in people with MS. So if any patient or any caregiver asks you, we have fatigue, should we undertake strength and power training? Definitely, but tailor-made. Now, the effect of Feldukrias technique in physiotherapy, this was given by an Israeli physicist, and there are lots and lots of literature which support the use of this technique. And this is quite close to motor imagery that we do, because in this, what happens, the patient is being taught the alternative patterns of movement, and the aim is to improve the human ability to learn movement. That means awareness through movement, and then functional integration. So what you have to do is, whatever, for example, my patient has developed a foot drop. So first thing that you have to do is make them aware which muscles have gone weak. Their dorsiflexors have gone weak. So it has to be in a very simple local language कि आपके पैर के ऊपर के मांसपेशी कमजोर हो चुके हैं, जिसके कारण आप अपना पैर का पंजा ऊपर नहीं उठा पा रहे. Okay? Then if a simple massage, a simple soft tissue mobilization, little proprioception sense training, they will help the patient to understand the role of that particular muscle. So this is the component of Feldenkrais method, and it has been proven to be very, very effective in multiple sclerosis patients. Now the mirror therapy. This is an age-old therapy which we have been using in stroke rehabilitation, and definitely it has very, very, very promising results even in multiple sclerosis patients. Then coming to Pilates, this is one of my favorite topic, and there have been lots of literature now which advocate the use of Pilates to improve the physical functioning. It helps to improve balance, functional mobility, core stability, and fatigue severity, quality of life improvement. And there are various kinds of Pilates instruments that can be used, and they are beneficial for the patient. So this is my center, Bihar Neuro. We have this partial body weight support equipment, and we have a lot of Pilates equipment. So a simple sample of Pilates-based rehabilitation, what we undertake in our center is, Pilates, we have to make sure the movement is well coordinated, the breathing patterns are taken care, the posture is taken care, and the muscle, wherever we need to concentrate, that is being properly activated. All right. So similarly, we launched a book on Pilates in rehabilitation in one of the MS meetings in September 2011 in Mumbai MSSI workshop by Mrs. Sheila Chitnis. She's one of the founder of Multiple Sclerosis Society of India, and Dr. S.M. Katra. Now, the high intensity resistance training in people with multiple sclerosis experiencing fatigue. So as Dr. Gunjan mentioned, every patient will have a different kind of presentations. For some, fatigue will be a very, very disturbing clinical feature, and for other, it will be a manageable factor. But there are lots and lots of studies which say that high intensity resistance training lead to clinically relevant reductions in self-reported fatigue associated with changes in plasma inflammatory protein levels, and it provides an evidence for recommending HIRT for fatigue. So I'm sure after knowing all these evidences, we are pretty much clear that MS patients power training, strength training, resistance training, it is not contraindicated. All right. Now, if we talk about fatigue, it is present in almost 77% of patients, and exercising and ambulation should be spread throughout the day, and the time of the day can be an important factor in the success of patients' exercise program, because this fatigue is also dependent on the environmental temperature. So what we usually recommend to our MS patients, so you exercise whether early in the morning or late in the evening or in an air-conditioned environment, or even this mist fans. A lot of our patients say that exercising in front of mist fans make them feel much more better and comfortable. So patients with MS also report greater fatigue in warmer climates. So there is a lot of heat sensitivity. So cooling jackets, increased hydration, fan, air conditions, and showers are all important strategies. And other tips are simplify tasks to conserve energy. Now, this is really one of the very important aspects, and this need to be actually counseled to the patient. As a rehabilitation expert, it becomes really imperative to, stick with the patient for one complete session and explain it to them how and why is it important to save their energy. Energy conservation tasks, for example, if there is a mother who has to take care of the family, so you can suggest them that the entire chopping job or, atta gundna, those kind of things which are more laborious, which require a lot of time, outsource them, get it done by somebody, some help if that is available, or make sure you sit and do it. We tell all our patients that if you are chapati eater, please sit on a higher stool and then make chapatis. They have to use these strategies. In the morning, keep a chair in your bathroom or a stool, sit and then brush your teeth, sit and then wash it. The less you are going to use your larger muscle, less fatigue you will feel, and you will be energized throughout the day. An afternoon nap is really, really must. If you are an office goer, make sure you get 20 minutes nap after your lunch hours. So these are certain tips which actually, first we have to understand the schedule of our patient, what is their schedule over the weeks and over the weekend, and then give them the solution. This is how you can save your energy. And regulate sleep habits. For that, we tell all our patients no mobile usage or screen 1 hour before you go off to sleep. Develop regular exercise program, avoid overheating, manage stress, and learn energy saving ways of walking also. Now, respiratory rehabilitation is another very, very important aspect. They can occur early during the course of the disease and are associated with neurological impairment and can lead to pneumonia and failure. And there are a lot of studies which said that respiratory muscle training can improve maximum respiratory pressure in MS, and lung volume recruitment can slow the decline in vital capacity. Simple, take one session only on respiratory muscles, how they have to cough, how they have to support the body, and nevertheless, we have the spirometer. Just make them learn the use of incentive spirometers, how they have to lift the ball, how through inhalation they have to use the ball, reverse it down, during expiration they have to use it, and most of them enjoy. And if they travel for work, ask them to use that in their vehicles if they are not driving through, and make sure this aspect is taken well care of. So a combined inspiratory and expiratory muscle training program for 5 weeks, it improves respiratory muscle strength and fatigue in multiple sclerosis. Cognitive dysfunction and potential benefits. Almost 40 to 60% of MS patients have cognitive dysfunctions. Multiple sclerosis, cognitive dysfunctions, and potential benefits of exercises. A. Feinstein was one of the, he has done a lot of work along with R.H. Benedict, Mortal. They have amazing studies which tell the importance of addressing cognitive problems. So the consideration of exercise training is warranted based on evidences which says that aerobic fitness, physical activity, and exercise training are associated with better cognitive function in older adults. Exercise training has comparable effect on mobility and quality of life outcomes in older adults and patients with MS. Unfortunately, cognitive impairments is largely present in our neurological deficit patients, but it is being least addressed. Once we understand, even in MS, there are two kinds of fatigue. One is cognitive fatigue and other is our physical fatigue. So all these needs to be understood, because why my patient is not ready to exercise, why there is a reluctance, why there is no, there's no inner sight from my patient to do that particular exercise. Probably he's suffering from cognitive dysfunction, and we have lots and lots of batteries through which we can assess the amount of cognitive dysfunction in the patient. And probably this was one of the topic of interest that pushed me to understand what is cognitive dysfunction, what are the various domains like attention deficit, working memory deficit, executive function deficit, that actually pushed me to get more into multiple sclerosis domain. And as a result of which I applied for Dupre grant and I received it twice. And this was my hospital at Bordeaux, where I studied on a simulator. We had a simulator where we were actually teaching the patients about driving abilities, because in Western countries, self-driving is very, very important to keep them going. So we studied how deficit in cognitive abilities is impairing the simple driving ability of the patients. Like, for example, my patient has been driving from the age of 16 years, but now when they are 50 and they are having cognitive impairments, they are not doing that. They are not able to do that particular task, which is almost automatic for them. They are not able to navigate their vehicle on the road. They get scared if somebody crosses by or the signal suddenly turns from green to red. So this was all cognitive impairment, and then we studied their brain functioning through functional MRI also. So that was really very interesting training that I underwent. And upon return to India, we did a quick screening of cognitive function in Indian MS patient, and we found, yes, cognitive dysfunctions are very much prevalent. Our study was presented in ECTRIMS conference, and then we have published our paper also in Annals. So this is one aspect which actually needs to be addressed meticulously. Why suddenly my patient starts feeling strange? Earlier they were happy with the exercise, and now suddenly they are becoming aversive. So there are certain indicators that we should be aware about. Next, gait impairment and optimizing mobility. In India, yes, we have a lot of support system, but definitely everybody wants to be independent. Nobody wants to be dependent on their children or maybe the partner to do their daily activities. So deficits seen in ambulation should be addressed to improve energy efficiency and reduce falls. As we saw, the spasticity leads to a lot of gait impairments, and that increases the frequency of falls. So this needs to be really, really addressed. And the gait abnormalities, they include decreased step length, decreased number of cadence, reduced joint movement, increased variability, and other parameters. So yes, EDSS is very, very important parameter to understand the physical abilities of our patient. So good analysis of the patient is very, very important. And again, I would emphasize, if you think you are not able to analyze gait efficiently in one go, or maybe even otherwise, after so many years also, I prefer video recording it and then analyzing that video very, very slowly, because there can be spasticity, there can be a foot drop also, there can be a mixed presentation. So sometimes it requires very slow analysis of each and every phase of our gait cycle to come to the conclusion that what exactly is my patient suffering from. Okay, so there are a lot of studies which say compensation through appropriate prescription of assistive devices, bracing and wheelchair will help improve safely. So a combination of pattern is seen basically in MS patient. There can be spastic paralysis, that means insufficient supraspinal recruitment of motor neurons in specific leg muscles. There can be ankle foot weakness also. You can see motor fatigue or weakness in ankle dorsiflexion. And then, yes, talking about the braces, we all know there are lots and lots of options available. So according to your assessment, whether there's a weakness in hip flexor or hip extensor, quadriceps spasticity, hamstring spasticity, quads weakness, we have a lot of choices from which we can pick. And we have to remember that make sure it's a lightweight brace, because the weight of the brace will automatically increase the energy expenditure in walking. So we have to, whenever we are taking decision for MS patients, make sure just weigh each and every option, that if I'm giving them even walking stick, make sure it is more stable, but at the same time it should be lightweight. So you have to weigh whether the stability or mobility, what needs to be prioritized over the other. Okay. Pelvic floor training. Yes, this is very, very, very important for urinary incontinence and also sexual function in people with multiple sclerosis. And I think these things are really need to be addressed in private along with their caregivers, because as we all know, multiple sclerosis strikes the main productive years of our life. So definitely wearing diapers outside, and first, the accepting the concept of wearing a diaper at adulthood does not come easy. Then impaired sexual functions, not able to expand your family. Though there is no problem in expanding the family, there needs a proper counseling that needs to be done, what has to be done in that particular case. And I guess with our physician, we can all work together and we can take care of patients to manage this. So yes, evidence suggests that pelvic floor muscle training like Kegel exercises, they are effective for treatment modality to improve quality of life and reducing the severity of urinary incontinence, overactive bladder symptoms also, and to improve the sexual functions. So decreasing urine leakage, neurogenic bladder symptoms, and managing all these things are also equally important, and they need to be addressed. Now, aging with multiple sclerosis. Please understand, multiple sclerosis is a disabling disease. Okay, it's a progressive in nature. It is disabling. So most of our patient age, but it is not protective against other diseases. My MS patient can have stroke. My MS patient can have heart disease. They can have diabetes. So they may come to you with comorbidity. So it becomes very, very important to closely analyze what all areas are affected and what all areas need prime importance or prime treatment care. Because as we all know, with aging, the frequency of falls and balance issues automatically increases. And if my patient is an MS patient, then definitely balance assessment plays a very, very important role, and its timely management also plays an equally important role. Web-based rehabilitation program, yes, as the time is moving, we are still, I would say, recovering phase from the COVID pandemic. So web-based rehabilitation has become really very important for, number one, these pandemics. We should be able to reach out to our patient, and moreover, I feel it's more cost effective. And number three, as before starting this program, we had a very lovely discussion that why like we don't know much of MS patient. Is it less diagnosis, or is it patients are not coming forward? What is it? There is one aspect which I have felt, people are shy to talk about this problem. People are hiding within their families. They are not coming out openly and saying, yes, I've been diagnosed with MS. महीने में एक बारी या दो बारी I go to Delhi or I go to bigger states to get my treatment done. I don't want my local people to know about it, that I'm suffering from this. So all these are acting as barriers, but very surprising thing has happened. Earlier, I also used to think that Bihar has a very, very low prevalence. But when we became online, there are a lot of people who are not revealing their identity, but they are undertaking our web-based program. So, the outreach to your patients has to be modified, because in our society, there are a lot of good or bad, whatever, people are scared to disclose any kind of progressing neurological deficits to their friends or maybe society per se. So web-based program really comes very, very handy, very, very handy. And internet is literally everywhere these days. So web-based physiotherapy for people moderately affecting MS, and quantitative and qualitative data has shown it's really, really effective. It is easy, it is convenient, and it is motivating. So in 2021, under the aegis of MSSI Mumbai chapter, we had launched the first ever web-based program for Indian MS patient. And on 8th March, the International Women's Day, we started this program. And we connected our patients through YouTube and WhatsApp. So every week, 3 times, 3 days a week, we used to give them exercise with all clear instructions, each and every step. We had cognitive exercises also for our patients. And then we used to take feedback from the patient. How are you performing your exercise? And it was overwhelming response. And then we used to send them, we used to correct them, ki, please take care, you are crossing this, your posture is not correct, this is how it needs to be done. So this was really good to see that within the comforts of their house, they were able to do these exercises. So this was an absolutely free of cost program. Patients were followed for 6 weeks, and session frequency was 3 times per week, and we targeted on their physical and cognitive rehabilitation. So on my channel, this was updated, and yes, I guess we did a pretty much good job in making a change in our patient's life. And then because of this study, we were fortunate. Our team was we were selected as one of the finalists, international finalists in MS Brain Health Awards. And yes, tele-rehab services, there was a reduction in the number, duration, and perceived effectiveness of rehabilitation sessions for people with MS during COVID-19 pandemic. Actually, this is a very beautiful study, which if you can see, like lots and lots of therapists across Europe, they were involved to find out, like over 200, they did an online survey of over 200 physiotherapists from 9 countries to find out like how has physiotherapy been going on for MS patient during this pandemic. So to ensure the continuity of physiotherapy, to ensure the continuity of physiotherapy for people with MS with complex healthcare needs during pandemic, there needs to be guidelines how we should go about it. And then another important aspect is accessibility to rehabilitation services. Now, rationing is actually a reality. This is a study from Australia and Europe, but definitely the truth lies in India also. Like when we talk about urban cities, yes, rehabilitation is readily available every nook and corner. But when we talk about our rural services, though there has been amazing and tremendous effort being done by government, and even in government of Bihar has been doing lots and lots of effort of recruiting rehabilitation experts, posting them in rural areas through suction centers and other areas to make therapy available for one and all. So definitely still there is a large lacunae that needs to be filled up to be available for our rural population also. And then, yes, balance, as I earlier mentioned, that fall prevention, gait management, and spasticity management are equally important aspects. Similarly, we have balance. And for balance, there are certain interventions like sensory facilitation and dual task practicing. So as I mentioned earlier, usually what patient says, कि जब हम धीरे से कोई काम करते हैं, we are okay, the motor firing is fine. But if suddenly they have to do something, the doorbell rings, they have to go open the door. There are a lot of cognitive processing going on कि अभी मुझे chair से उठना है. We might not think as a healthy individual that getting up from the chair itself is a task. But for these people, the moment the bell rings, they start thinking, okay, fine, now I have to get up. I have to make sure I have to catch my stick or maybe my walker, or I have to shift to the wheelchair. I have to go to the door, open the door, and make sure I reach within a stipulated time, because जो बंदा बाहर खड़ा है वो indefinitely नहीं खड़ा होगा. So these things create a lot of panic situations. So we say dual task practice is very, very important. Similarly, if you would have realized, dual task practice we have been doing in our college graduation days. Why? If somebody is doing exercise on the quadriceps, we tend to ask certain questions. Okay, tell me 2 + 3 is how much? 4 + 5 this. Acha, aaj kya hai? Maybe certain things. So what you have to make sure that they exercise and they talk about general things also at the same time. That will actually improve a lot of their cognitive abilities. Then yes, vestibular rehabilitation has been shown to be really effective for these patients to improve balance. Core strengthening exercises are also very important and effective. And then Nintendo Wii and balance-based torso weighing. If we attach certain weights in their torso and ask the patient to stand erect, that has also been shown to be very effective to improve their balance. Fall prevention, definitely it is very, very important. And, the reports have stated that about 50 to 58% MS patients are prone to falls. So definitely this area needs to be addressed, and fear of fall is also very high amongst MS patients. So ambulation, as we said, everything needs to be measured well. We have 12-minute multiple sclerosis walking scale, EDSS, Hauser ambulation, walking functional ability, 6-minute walk test, 6-spot test, then 30-second sit to stand test, timed up and go test. And according to your patient, you can pick and choose whichever test you want to use. And then interventions, like usually two are one of the most proven therapies. They are partial body weight support, treadmill training, and excuse me, robotic assisted treadmill training. Both are readily available in India. In my center, I make maximum use of body weight support treadmill walking, and then functional electrical stimulation and orthotic assistive devices and wheelchair mobility. Please understand one thing, wheelchair does not describe your disability. I tell to a lot of my patients that you can use wheelchair to a certain extent to save your energy and stand and walk for a certain time only. So wheelchair addition in their lifestyle has to be meticulously done and with the proper reasoning. Otherwise, people are usually very much against use of wheelchair. Okay, now this is last study which I would like to describe. It is content and delivery of physical therapy in multiple sclerosis across Europe. This study is basically review of reviews, and they have given very important tips to how to go about with physical rehabilitation in MS patients. And more intense therapy, more it is affected, and physiotherapy is one of the most commonly used techniques, and it was anticipated that task-oriented interventions, they are more efficacious. And however, only 43% of the patients were in contact of their physiotherapist, and tele-based rehabilitation approaches need to be considered. And then there were certain recommendations for rehabilitation, multidisciplinarily rehabilitation physiotherapy services and exercises are more effective. And certainly cognitive therapy, physiotherapy, respiratory training, robotic assistant, virtual reality, Pilates, Tai Chi, they are all very, very advantageous. And exercise postponement theory. Please tell your patients that long-term moderate to high intensity exercise, they postpone the onset of clinical diagnosis of MS and moderate disease activity. Exercise and face-to-face cognitively inspired educational programs are very effective. Cognitive rehabilitation is very important. Occupational therapy is very important. Please guide your patients about nutrition, stress management, temperature care, and diet. Please refer them to a good dietitian. It is very, very important, as Dr. Gunjan, it's entire teamwork. So everybody has to be cross-referred at due time. If your patient is partying around and having a lot of cola drink, you have to tell your patient, please, now is the time you got to see the dietitian also. Okay. So recommendations for rehabilitation professionals. So we should know the level of functioning, the independence and quality of life of our patient. Then we have to make patient-centered goal, and we have to understand the MS patient, his working age, and what kind of duties at home and at society level he has to do. And definitely home-based programs are very, very important. Good environment is much more important, and cognitive impairments have to be taken care all the time. And involving, yes, caregivers. At the end of the day, caregivers are the one who are bearing the maximum brunt of multiple sclerosis. So they should be involved. They should be encouraged to exercise. Patient and the caregiver together can make a group. So involving the partner is very, very important, and logistic factors like childcare, access to rehabilitation services, everything has to be taken care. And I'm very proud to say that Multiple Sclerosis Society of India provides a lot home care activities to the patients. So in 2022, we launched yet another program in which we emphasize on our patient that if you can't imagine, you cannot learn. So basically, exercise all our patients have been more or less doing, but what we are trying to emphasize in them, please make a visual image and a motor image of the exercise that you've been doing. For example, when visual imagery, we ask the patient to just imagine the exercise, चाहे आपको exercise Okay, so this was simple imagination. हम patient को बोलेंगे, just imagine you are sitting in a room and pressing the ball. Okay. Now, kinesthetic is when you have to feel the movement, you have to feel the muscle where exactly you are performing the movement. So when we talk about kinesthetic, we have to tell each and every step. Ask the patient that how they are touching the right knee to the ball, how their back has to be, how the hind leg has to be, how they have to transfer their weight, how the breathing pattern should be, and while performing that particular exercise. Kinesthetic takes care of the entire muscles involved when we are doing this. Feel the muscles involved and their action. So as we are all celebrating our World MS Day, it is all about making connection, and it is very, very important to conduct lots and lots of awareness program. And as a rehabilitation experts, it becomes really very important for all of us to understand that awareness program play a very, very important role to improve or to wade away actually all the doubts of our patient. So like in 2021, we gave them the exercise protocol to perform the exercise. 2022, it was imagine the exercise. And in 2023, it is about making them more aware about the benefits of exercise program. So awareness program so far carried out since 2011. I've been like ever since I came back to India after my training from France, I've been advocating about cognitive rehabilitation and Pilates across India, and we had been lucky to cover almost all the chapters of MSSI all across India. And even in Kyoto, we were able to take a satellite symposium for MS patients from Japan. And yes, it is very, very important to make a difference, and we can make the difference by only being involved. I'm the alumni of Multiple Sclerosis International Federation, and every year they have openings for McDonald's and Dupre grants. So whosoever is interested in research, please go out. The world is open for you. Find out your topic of interest, your area of interest. Talk to the researchers, show your interest to them. They'll be ready to host you, and then you have all the funding to go about and do something for these patients. Time is absolutely right. And if you see, we have over 9
Ma'am, are you able to hear us? I think there is some connection issue over here.
I think we lost her.
Yeah, most probably there is some connection issue. Let's wait for some time.
Sure.
Hello.
Yes, ma'am. Are you able to hear us?
Yeah, now I can. I didn't have connection.
So were my slides visible?
Yeah, the time is ripe. Till that slide, we
Okay.
were able to listen.
Okay. Yes.
You can continue, ma'am.
Yeah, after that, it was great. Thank you, slides. Thank you, all of you. Me here, and I guess the time is right. We have a very less number of patients. So just make sure to reach out to as many patients as possible. That is very, very imperative for all of us. And as a rehabilitation expert, the registered MS patient are just 2,500, and we are lakhs of therapists. So let's go around, find out the patient, and be available for them. Thank you. Thank you so much.
Thank you, ma'am, for such a wonderful presentation and the knowledgeable presentation. We have some questions from our participants. So let's take the first question. The first question is, what is the dosimetry or exercise prescription for people with MS?
Okay, this is a difficult question because physiotherapy doesn't go without fit principle. And as I said, each patient has to be analyzed individually and it has to be tailor made. So when I call it tailor made, I don't say if I have medium size patients, सबको medium kurta ही पूरा आएगा, नहीं, उसमें modifications चाहिए. So the dose has to be modified according to the patient. Please use the rating scales, the assessment scales. उसी हिसाब से हमें पता चलेगा. And the schedule कि हमारा पेशेंट किस तरीके से काम कर रहे हैं, उनका वर्क लाइफ बैलेंस क्या है. That is how we'll be able to tell them कि आपको इतने डोज पे काम करना है. And also never forget 1 RM maximum. Find out the 1 RM for that patient, for that particular muscle, and then we will go for dosimetry of the exercise.
Thank you, ma'am. So the next question is in the chat box. What is chemodenervation?
I'll push that question to Dr. Gunjan.
Gunjan sir, would you like to answer the question? Your mic is not on.
I think there's just some network issues. Just a minute.
All right, so I guess
Yeah, I think.
Okay, sorry.
Hello? Yeah. Yeah, probably I think what you're meaning is that I think there's some echo. Probably others can switch off their mic. 1 minute. Yeah. Probably chemodenervation, probably it means that we are using the drugs or the chemicals and other things in this is mostly for spasticity what is being used, and there are various drugs that are being used, and I think botulinum toxin is also one of the things which is being used for spasticity, and this is I think the chemodenervation is a term probably which deals with this various drugs and various things which is used in this treatment. Hello.
Okay.
Yeah.
Thank you, sir. So we have next question. Is hot pack for any kind of muscular pain indicated in such patients, MS patients?
Yes, you can use that. Avoid overheating. So usually I give them hot pack in winter season or rainy season just to remove spasm, because nothing works better than a good hot pack for muscle spasms.
Sure. Thank you, ma'am. So we have another question. What's the connection between high intensity resistance training and Uthoff phenomena?
And Uthoff phenomena.
Yes, ma'am.
Okay. So basically, this is a very I would say a controversial topic, because why? If we connect both of these things together, high intensity training has been asked not to give it in MS patients. Okay, because we say ki Uttha phenomena that takes place that leads to overheating in our patients and all that. But what I feel is high intensity training, it helps to build your muscle fibers better in a shorter duration, and the other aspects that we have been talking about, that it's not about the power, the strength, it's about agility also and the endurance also. If my patient has to carry out any work, there should be a rapid firing through the muscle fibers. So those things, they happen with resistance training. So I guess, yes, a thought phenomena is very much there, but if you are giving your high intensity resistance training under a controlled environment, that does not lead to DOMS, delayed onset of muscle soreness, and also it does not lead to overactivity by the involved muscle, there is no problem. There is no problem in doing that.
Thank you, ma'am. So there's another question. If we go for high intensity training, is there a chance of relapse?
If you go for a high intensity training, which is supervised, which is tailor made for you, trust me, physiotherapists don't lead to relapse. We don't need to relapse. It's a natural course of the disease. But what I'm saying is, do your exercise under a physiotherapist. I'm not talking about gym trainers and all. So, and that too, the physiotherapists who are trained to handle multiple sclerosis patients. Right. So trust me, we don't cause relapses. But definitely negligence on the part of understanding sometimes on both the parties, that might lead to exacerbation of the symptoms, which is not actually a relapse, but which may mimic sudden slowness of activities in the patient. Okay.
So there's another question. So question is like that: if there's a person who goes regularly to the gym for exercising, and suddenly he or she is feeling a shock-like sensation on the back, so is there any chance of MS?
I think I would like to answer that. Basically, this is this. Yeah.
Sorry. Yeah.
Yeah, basically this is what we are talking about, the Hermite's phenomenon or Lermite's phenomenon, whatever way you can pronounce it. If you look at this, there are two major causes of this. One is MS, but second is disc, that is your disc compression. So if a gym goer has this typical problem, I would not think of MS as the first differential diagnosis. I would think of a wrong posture and a cervical disc, which is causing this problem. Because many of the exercises, what you're saying, that especially this one, upar wala, what they do is they have their necks like this, and especially after the onset of the electronic devices, mobile phones and the online classes, you see the posture, everybody has this sort of posture with cervical straightening. They go straight to the gym, put jitna weight dal sakte hain uske baad, and then they straight away go this one, and the disc comes out, and then that would be a more plausible cause rather than just straight away jumping to multiple sclerosis in this case.
Yeah, thank you, sir. So any other queries?
One query from my side.
Yes, sir.
From a patient perspective, as you are the member of the Multiple Sclerosis Society, so what all basic function of Multiple Sclerosis Society, and how the patient, if some patients are coming, how they can get help from the Multiple Sclerosis Society? अगर इस पे आप कुछ लाइट डालना चाहें तो हमारे पेशेंट्स के लिए काफी बेनिफिशियल होगा.
Like MS Society has over 9 major chapters in major cities. So basically, जब भी कोई patient आता है, obviously accepting a progressive neurological disorder is not easy. So one of the most primary things as a MS Society we do is to counsel the patient and the caregiver, make them understand that this is first not going to pass on to the next generation. आप अपनी family planning कर सकते हो, बच्चों की शादी भी regular हो सकती है. अगर आप work में हो, आप continue कर सकते हो, and you have to open up to your employee also. So these things, these counseling things are provided by MS. Then day to day हम लोगों में MS Society के medical होते हैं, and medical camps से फायदा ये होता है कि all the specialists they come together under one roof and patient के जो भी problems होती है उनको address किया जाता है and then a patient can make informed choices कि हाँ मुझे इस neurologist से आगे consult करना है, इससे करना है या इस therapist से consult करना है. ऑल्सो जहाँ होम केयर की ज़रूरत होती है वहाँ पे भी सोसाइटी अपने लोगों को भेजता है, नर्सिंग स्टाफ को भेजता है ताकि जो पेशेंट अफोर्ड नहीं कर सकते हैं उन सबकी केयर हो. लाइक फॉर एग्जांपल द फिजियोथेरेपी सर्विसेज दैट आई प्रोवाइड फॉर एमएस सोसाइटी, इट्स एब्सोल्युटली फ्री ऑफ कॉस्ट. सो वी आर ऑलवेज अवेलेबल टू टेक अप देयर कॉजेज एंड ऑल्सो डिस्ट्रीब्यूशन ऑफ कैल्शियम, डिस्ट्रीब्यूशन ऑफ सर्टेन ड्रग्स. कईयों को लाइक फ्यू ड्रग्स आर रियली रियली एक्सपेंसिव, तो एमएस सोसाइटी भी अपनी तरफ से बिकॉज वी हैव सम एंजल डोनर्स, उनसे फंड्स आते हैं, उनको वो दवाई मुहैया करवाई जाती है. बाकी उनकी जो फिजियोथेरेपी थ्रू सोसाइटी भी होती है वो बहुत ही सब्सिडाइज्ड रेट पे होती है. द थेरेपिस्ट टेक्स बेसिकली द मनी फ्रॉम द सोसाइटी इटसेल्फ एंड बाकी देयर आर लॉट ऑफ फन एक्टिविटीज ऑल्सो. एमएस सोसाइटी ग्रुप्स बनते हैं, सेलिब्रेट द डेज, लाइक कभी टी पार्टी हो रही है, कभी आइलैंड विजिट हो रहा है. इट इज जस्ट अबाउट सारे एक जैसे लोग एक साथ रहेंगे, एक दूसरे की स्टोरीज शेयर करेंगे टू हैव अ गुड टाइम एंड अ हैप्पी लाइफ टुगेदर. एंड काफी बारी एमएस पेशेंट्स के बीच में भी शादी हुआ है. So even matrimonial services are indirectly happening. It is just to tell them that we are all there for you and the life is beautiful ahead and we will all face it together. So that is what the society is doing.
Very informative part from the MS society that they are taking care all the aspects of the patients who are suffering from the multiple sclerosis patient.
Yes, sir.
So I think this will help all the professionals can guide the patient. They can go to the nearest multiple sclerosis society and they can approach if they need any sort of the help rather than going a individual centric places. So this is a special place where they can get help from them.
Yes, sir.
Thank you for the information. Yes, Preeti.
So there's another question in the chat box. The question is like that: if such a patient falls down, whether the cold pack is better or the hot pack would be preferable for such patient?
The first is to put the patient. The first thing, अगर पेशेंट गिरता है एमएस से, आप उसको बेड पे डालिए एंड हॉट पैक कोल्ड पैक तो बाद में आएगा. पहले हमें देखना है कि वो गिरे क्यों. मेक योर पेशेंट कंफर्टेबल, मेक देम ब्रीथ प्रॉपर्ली. वो वर्टिगो अटैक आया था या डबल विजन के कारण या एक डिजनेस एपिसोड था, व्हाट वाज द रीजन ऑफ देयर फॉल. एंड अगर कहीं ब्रूजिंग हो रही है, नील आ रहा है, तो इमीडिएट में तो हम लोग कोल्ड पैक लगा सकते हैं, मेकिंग यूज ऑफ लुइस हंटिंग रिस्पॉन्स. क्विक आइसिंग करना है या थोड़ी देर के लिए लगाना है, दैट विल बी अ इन्फॉर्म्ड. बट अगर केयर गिवर को बोलना है तो यूजुअली हम कहते हैं कि अगर नील पड़ जाए, वेरी स्पेसिफिकली आई एम सेइंग नील पड़ जाए, देयर इज अ ब्रूजिंग, आप कोल्ड पैक. तो जो हमारा यूजुअली चलता है इनिशियल 72 आवर्स तक, आप उसको कोल्ड वो चलेगा. बट मोर इम्पोर्टेंटली अगर कोई गिर रहा है, इट इज इम्पोर्टेंट टू फाइंड आउट व्हाई देयर हैज बीन एंड मेक द पेशेंट कंफर्टेबल. दैट इज द फर्स्ट थिंग. बेड पे लिटा के आराम से पहले लेटनी चाहिए.
Okay, thanks a lot, ma'am, for so many questions, and thanks, sir. So now I would request Shri Saurav Saha, Senior Physiotherapist, Junior Lecturer, to give the vote of thanks.
Thank you, Preeti. Audience and dignitaries, I hope we all have raised our awareness and knowledge about multiple sclerosis with these informative sessions. It's my honor and privilege now to give vote of thanks to all those who helped to make this web session happen. To celebrate World Multiple Sclerosis Day as directed by Department of Empowerment of Persons with Disabilities, Ministry of Social Justice and Empowerment, Government of India. Myself, Saurabh Saha, on behalf of Department of Physiotherapy, NILD, would like to thank our Honorable Director, Dr. P.P. Mohanty sir, in charge Deputy Director, Administration, Dr. P.K. Linka sir, and Assistant Director Training, Dr. Ahmed Iqbal sir, for giving this opportunity and support to conduct this webinar and sharing their valuable thoughts with us. I would also like to express my gratitude to our HOD, Physiotherapy Department, Mr. Praveen Kumar sir, for providing continuous encouragement and guidance at every level of the organizing this webinar. I would also like to thank all HODs and in charges of NILD for their support. I, on behalf of National Institute for Locomotor Disabilities and the entire organizing team of Department of Physiotherapy, especially the guest in the audience, together and on my own behalf, want to extend a very heartily vote of thanks to the speaker, resource person, Dr. Gunjan Kumar and Dasprit Kaur ma'am for gracing your important work in the field of multiple sclerosis and sharing with us your valuable knowledge and time. Therefore, today's comprehensive session and both of your vast insight about multiple sclerosis has enlightened us with new notion and rationalism. Thank you once again, both of you. Finally, I would like to take this opportunity to thank all the organizing members of the Department of Physiotherapy, especially Ms. Preeti Chowdhury for moderating this session and helping in successfully conducting this event. Last but not the least, I would like to convey my sincere thanks for the epistemic participation by our student and the audiences from various field of rehabilitation. Hope we will use this knowledge in our professional field for improving quality of life of person with multiple sclerosis. Thank you everyone. Thanks again. Preeti.
So let's end today's session with the national anthem.
Stand up.
So we have come to the end of our session.
Okay, once again, thank you everyone for joining this program. Thank you so much for taking out your valuable times, Dr. Gunjan Kumar, Dr. Dasprit. Thank you so much for joining this program. Thank you.
Thank you, sir, for the invitation. Thank you.
Thank you.